Hello guys, we are just waiting for about 2 minutes to allow all people to be in.
RYR, the host again.
Okay. Assalamu alaikum warahmatullah. Good morning, everyone. Welcome to our session today, which is about audit and quality improvement project. The session is conducted by the British Sudanese Association of Pediatric and Child Health. My name is Mohammed Abdoun. I'm one of the pediatric trainees at Yorkshire and Hamba, and I'll be your moderator for this session today. For this important topics, we are quite happy to welcome a distinguished speaker, who is Dr. Reem Kamal. Dr. Reem is currently working at the ST3 Registrar in Clinical Radiology. She's previously experienced in general and vascular surgery. The meticulous nature of this specialty inspired her to produce precise and concise medical report. Dr. Reem trained and graduated at University of Khartoum in 2009 before joining the NHS system in 2011. She adapted to the needs of the NHS system and learned about the clinical audits and how to apply to the clinical practice. She did a lot of audits and quality improvement projects and published some of them in regional and international meetings, which became her area of interest. With all of that, we are quite eager to welcome Dr. Reems and hear from her experience today. So please, guys, could you just kindly keep your mics muted, and you can pop the question in the chat or can raise your hand. Dr. Reem will answer it later. So you are welcome, Dr. Reems, and the floor and mics are yours.
Hi, Mohammed. Thank you very much for the generous introduction. I'm delighted today and honored to actually present this presentation in your organization. I will try to keep it as simple and as fun as I can, because it's a very dry topic, yet very important. And today we're going to go through audits and quality improvement projects for junior doctors. And I added made easy because this is my aim today. I really want to make it seem like an easy process. And I hope that you will go out today from this session feeling very enthusiastic about doing an audit and also feeling very competent. Okay, so we'll start this session with some questions. So I hope you will all participate. Can we have the poll on, please? So these questions are not meant to be right or wrong. There is no information. It's just basically for me to know what is your knowledge level at and what are you expecting today from this session. Okay. Next question. Okay, next question.
I think there is some technical issue, Reem, so I'm just going to try to sort it out, and just give me 2 minutes, okay?
No problem. I think this questions now, we'll just leave it for later.
I think Reem, we sorted the issue. Can you, Muhammad, share the question, please?
Yes, so I think it's ready now for voting. Okay. All right. I can see a large number of audience, but I can see very few are participating. So it's really important that you all think about these questions and participate. It will just make it more fun and more understandable once we go through the session. Okay. Can we have the next question? So I hope you all participate in this question. It's just for me to know which areas to focus on. I encourage everybody to actually participate. Okay. That's fine. Next question. I think we'll stop the poll here and we'll start. Sorry, Arwa. Yes, this is for the upcoming poll. All right. Is it okay if I just proceed?
Yeah, go ahead, Reem.
Thank you. Okay, so what are the objectives for us today in this session? We will try to familiarize ourselves with the concept of the quality improvement project. How is it different when we say an audit or we say a quality improvement project or a research? We'll try to understand all these concepts. We will also try to understand the principles of conducting a clinical audit, and we should be able to grasp at least the structure in our heads and then try to practice it in our jobs and in our placements. Hopefully it will be made easy after this session. And also we will try to familiarize ourselves with the steps one by one, because sometimes we get lost in how to do some stuff and then we get stuck in one stage of the audit and not finish it to the next stage. But hopefully we will try to cover everything so you can safely and quickly do an audit in this placement or even your next placement, okay? Now, ideally, I would love for the session to be more interactive, as in I would love you guys to actually answer these questions, but I will try to go through it and we'll have another poll later on in the session. So what is an audit? What is a quality improvement project? And what is a research? So an audit is basically defined as testing the clinical practice against set standards. So it is actually trying to find out if the clinical practice that is taking place now is up to the standards. Is there any shortages? Is there any concerns? Is the actual standards realistic? So sometimes when we do an audit, and we find out that there is a lot of concern that we're not meeting the standard, and the shortage of not meeting the standard is, let's say, 50% or more, then we have to question the standards. We have to question the guidance that we are actually following. Is it realistic? Is it measurable? Did I actually do the audit the right way? So there is lots of questions that, or lots of areas that we need to cover properly to be able to actually test the clinical practice. And also an audit has to have standards. And this is the main difference between an audit and a quality improvement project. A quality improvement project could be something like review of practice. So for example, if I am in a department where there is no guidelines about a thing, let's say about gallbladder polyps and imaging gallbladder polyps, okay? I'm using examples from surgery because I've got like a vast experience in surgery, so it's easier to actually make examples, but then you can always apply it to pediatric topics. So for example, if I have something that has no guidelines, for example, imaging gallbladder polyps, okay? So what I can do is I can go through the literature and see other places, what are they doing? What are the guidance on that? What are the research on that, okay? And then basically apply this in our hospital by producing a local guidelines. And then I can review the practice afterwards, or I can audit my own guidelines afterwards. Sometimes review of practice could be just as simple as we're trying to review a service in something. Is everybody getting vital signs measurement in the A&E within, let's say, an hour of their arrival, okay? So in this also there is a standard, and there could be not a standard. So the difference between an audit and a quality improvement project or a review of practice is standards. So an audit has to have a standard and has to be a very clear, specific standard, and we'll go through this during the session, okay? Now, again, what I just mentioned, the quality improvement project is just monitoring the appropriateness and the quality of patients' care without having any set standards to that. And that is also considered a quality improvement project, but it's not an audit. Now, this is a very popular interview questions. If you are going for a training job interview, or if you are interviewing for the first time in the UK, they always love to ask this question. Do you know the difference between research and audit? And for some reason, people sometimes are not prepared for this question. So please do go through this table. So I will just briefly go through it. An audit is to inform the delivery of the best care, or to test the practice against set standards. But then in research, there is no set standards. What we're trying to do is add new knowledge, okay? We're trying to test the hypothesis or the nil hypothesis, all right? And we are trying to take a vast majority of a sample. We can randomize that sample, but in an audit, there is a very, very specific target group and population, and sampling is very specific, and we cannot randomize it because we're trying to test the application of the standard in a certain place or a certain area or a certain process. So if you basically get faced with this question, the most important or the key information is that research adds new knowledge, while an audit is basically testing the clinical practice, and there is no new knowledge added by doing an audit, okay? Now, why do we need to do audits? Why is it very important? Well, there is a lot of reasons why we need to do audits. First of all, it is a key requirement in every interview, every application form in the United Kingdom in the NHS. And it is quite essential that you actually complete a cycle. So it's not just doing an audit, you just also have to complete this cycle, and you have to know the importance of the whole cycle and why is it very important. Now, there is a very popular concept in the NHS, which is basically the clinical governance. And one of the pillars of the clinical governance is research and clinical audit, together with other pillars of clinical governance. So that is why it's very important to do audits, because we are trying to always make sure that the practice and the clinical practice is up to standards and the patients are receiving the best quality of care. And not only things that are happening to the patients can be audited. We'll just go through this presentation where I will explain that a lot of things could be audited. Structure of the management could be audited. Guidance in like national guidance could be audited. Anyway, we'll go through this. Also, it ensures that the service provided are up to standards, like we mentioned, key requirement, clinical governance, one of the pillars of the clinical governance, and it also helps you prepare for more senior roles. So when you get involved in audits, especially audits that has to do with a structure, let's say, let's audit this month if the junior doctors on floor and the A&E at night are sufficient, or are they under stress and we need to actually add another role, for example, like a nurse practitioner to be with them for support. Now, these kind of audits are always good audits in your CV, especially if you are a registrar already and you are going to apply for consultant jobs, because this shows that you have interest in management. And also it prepares you for more senior roles when you become a consultant to have a role in management as well. Okay. Now, what can be audited? Everything can be audited. So we can audit the national guidelines if we are actually, like, for example, NICE guidelines, okay? If we're actually practicing NICE guidelines in a certain thing, like administering a certain antibiotic, or putting in cannulas and filling in the cannula forms. So I'm trying to use a very simple examples for junior doctors, as in SHOs or foundation doctors, and you can apply it to bigger examples as well. Okay, so regional and local guidance as well. So it could be just in the deanery, these guidance, which was agreed on a regional meeting, and it's been published in a regional website for this deanery, or it could be local guidance in the hospital. Now, also sometimes international recommendations and consensus, especially for rare procedures or rare conditions, could be applied in your hospital, and it also can be audited. Okay. You can also audit outcomes. Let's say if you are working in a field in pediatrics where you do procedures, okay? So the outcome of these procedures can be also audited. Is the patient satisfied? Is the procedure going on smoothly? Are there equipments that you need? What are the standards of this procedure? And you can audit each and every standard. Okay, and as I just mentioned, the structure as well, and always the audits that audit the structure are managerial audits, and it shows a lot of leadership. So I really encourage you to actually explore that field, because there is a tendency to always try to audit clinical topics, and it's easy as well, but then the structural audits is what makes you stand out in interviews, especially consultant interviews and senior roles. Okay. So who gets involved in doing an audit? Everyone gets involved in doing an audit. Everyone has to do an audit, no exception, okay? So this Oprah poster here is telling you, you get an audit, you get an audit, everyone gets an audit. I'm also trying to say, what I'm trying to say with this poster as well, besides involving your clinical supervisor in the process and also the audit department, as you have to submit a form, okay? You can also involve your colleagues. So let's say you want to do an audit on a big sample in a very short period of time. You have 100 patients or 100 notes or 100 performers that you want to go through. So you can actually ask your colleagues for help, and they can help you collecting the data, analyzing the data. So by this, you are actually creating a team. And you have to first involve your clinical supervisor. Obviously, you have to tell them you want to do an audit. And the best thing is to approach them first and ask them if there is any audits that they think needs to be done or pending in the department, because that's always something useful for the clinical supervisor or the consultants or the department and yourself. And then the other thing is, if the clinical supervisor is basically out of ideas, then you can actually be proactive and come up with an idea, and we will go through how can you question an idea, which is if it's good for doing an audit on or not. Okay, and then once you decide on an audit and once your clinical supervisor agrees, then you can start structuring the audit and applying for the audit department to actually approve your audit and give it an audit number. Many years ago, I started my career in the NHS in 2011. So many years ago, it used to be just, if you want to do an audit, just do an audit. But the registration of audit made it very much organized, and every audit has a number. So you can't really fake that you've done an audit, because now every audit has a unique number. And when you go to interviews, they actually check that number or check there is a number next to an audit. So it's very important to register your audit in the audit department earlier on in the audit process. Also, the other advantage for the audit department registration is that the audit department can tell you if this audit is being done right now by somebody else, or if it's done just like 2 weeks ago or a month ago. So it wouldn't be really useful if you do the same audit in a very short period of time. So that's another advantage of getting the audit department involved as early as possible before starting collecting the data and doing all the hard work. Okay. Now, I think we went through the questions of this poll, but I'm not sure. Can we have the second poll? Actually, we didn't go through the questions. It's about the process of the audit. Yeah, I think we answered this question in the previous poll, but it's okay.
Sorry, Mohammed, can you share the second question, please? Because I can't share it from here.
So an audit cycle is only closed once. Is that true or false? Can everyone participate? Yeah, good. The second question is clinical audits and review of practice are both the same concept. I think we answered this in the talk just gone. But okay. Some people are still saying true. That's fine. Okay, I think that should do. Thank you very much. So about the audit cycle, we'll go through it now. About the clinical audits and review of practice are both the same concepts. They're not. We just mentioned that audits has to have standards, okay, that we are trying to test the practice against. But review or clinical reviews, you don't have to have standards. It could be some question going on in your mind. Let's say I've done a review of practice about abdominal plain films. So my question was, abdominal plain films, is it an outdated modality or is it a useful diagnostic tool? So there is no really any standard to that. I'm just trying to find out whether abdominal X-ray has added any information to people who are coming to the A&E with abdominal pain. And what I came out as a conclusion from that project, that it is actually only useful if you're questioning intestinal obstruction, and it's not useful in the other indications that are specified by the Royal College of Radiologists. And CT scan is almost always used. Okay. So yeah, so that's why audits are different than review of practice. They're not the same thing. Audit has to have standards. Okay, so if you want to come out from the session with one piece of information, is that audit has to have standards. All right. Okay, so what is the audit cycle? We hear close the loop audit cycle. We need to go through this audit cycle, and trust me, if you do an audit once, okay, it just basically engraves into your memory. You first identify a topic or a problem or an area of interest that is catching national and international interest, like COVID, for example. When COVID came out, okay, lots of new guidelines came out. So all of these guidance were raw. So anybody can audit these guidance and it will be of interest, and it's very easily publishable, this audits, because everybody would want to know if these guidelines are working. Okay, so identifying a topic or a problem or national and international interest, or something that will reduce funding or increase funding or whatever. So the management and all of the departments are always concerned with the financial aspect of things. So if you have a topic that involves funding, it's always very popular audit. And it also shows that you have the initiative to have senior roles in management, okay, like similar to structural audits, all right? So you identify a topic and then you select the standards, right? So you identify the topic and the problem, and now you have to identify the standards, right? So how do you identify the standards? You basically see what guidance are being practiced in this hospital. So I keep saying guidance and I keep saying standards. So what's the difference? We'll go through that, okay? Then you collect data, Okay, and when you want to collect the data, you first have to identify your population group and how are you going to sample it? How are you going to include and exclude? Okay, and then your data collection tool. Do you need one, or is it just a simple, for example, a paper form performer that you're going to give out and then you're just going to put it on the Excel? Okay, and then once you have your data nice and neat, you will just analyze this data. Okay, and some of us have very high technical IT abilities, I must say. You know how to use SPSS, for example, but some are just like myself. I only know how to use Excel sheet and just do pie charts and bar charts, and I find it really basic but also very simple. So you have to be able to present your results in a very simple way and also a catchy way. Okay, so you analyze the data, so you have to make something out of this data. You have to make a conclusion if there is any concerns, if there's any shortages in practice, if the practice is not up to standards, and why. So you have to basically have a discussion on why is this happening and identify the problem. And then when you identify the problem and have all these information, what you do is you present it in your department or in a regional meeting or a national meeting or international meeting. Okay, and then you come up with a plan of action or an action plan, okay? And then you implement this plan of action, which is implement change, okay? And then you allow enough time for the changes to happen or to take place. And then you have to specify a time period or a time scale where you're going to re-audit this and basically make sure that there is sustainability of improvement, one, and also that what the recommendations that you made on this cycle is actually being followed, okay? So this is the very simple version of the audit cycle, okay? Now, there is audit stages, and you don't really have to, let's say, know the difference between an audit cycle and an audit stage because it's very interchangeable. But then I find the audit stages is more simple to explain the stages or the steps that you have to go through one by one to actually get to the end of the audit and complete the cycle again and again. So the answer to the question of the audit cycle is completed only once is false. The audit cycle can go on forever and ever and ever. And that's why it's called a cycle, because it's a continuous process of trying to test the clinical practice against standards, try to make sure that the patients are getting the best quality of care, try to make sure that the staff are structured the best way, try to make sure that the funding is actually being used in the right places and the most suitable way. So it is an ongoing process and it doesn't stop. So an audit can be going on for years and years, and one cycle can be closed and 10 cycles can be closed, okay? Now, in the stages of doing an audit, all right, we have to plan this audit, okay? And then we have to think and work out the standards and the criteria of selection. And then we have to measure the performance by collecting the data, analyzing the data, and drawing on conclusions to these data. And then making improvements and implementing the change that we actually think will improve the practice. And then sustaining improvements, which is completing the cycle once and again and again and again, okay? So let's go through this. Now, so some people will say, what can I audit? You know, what ideas, what things can I audit? Now, I can't come up with an idea. If my supervisor does not give me an audit, I can't do an audit. That is false. That is completely untrue. You can always do a very good audit and you can come up with the idea yourself. Okay, that's why I added this poster. I don't know who you are, so I don't know the topic now that you can audit, but I will find you and I will audit you. So it is very easy to find. You just have to ask yourself a few questions, okay? Is the topic concerned of high cost? Okay, volume or risk to staff or users. So these kind of topics, they actually grab the attention of management, grab the attention of the audit department, supervisor, everybody wants to reduce the cost, okay? Is there evidence of wide variation in clinical practice? So do we do something and then in another deanery within the same country, another thing is happening and it's actually better in clinical practice, or you think maybe if we apply it in our hospital, it will have an impact. Something that is done internationally and you think that if you apply this to your local hospital, it will have a very good outcome yielding. So also, is good evidence available to inform audit standards, for example, systemic review or national clinical guidance? So for example, if you are actually wanting to audit a topic, okay, but then there is no enough evidence to provide you with any standards, okay, then this will be just a review of practice. And actually research for this question would be better because then you will add new information and you will add new knowledge and you will test the hypothesis, null hypothesis, whatever, okay? Other questions could be, is auditing the problem likely to improve the healthcare outcome as well as the process? Is there evidence of a serious quality problem, for example, service users? Is there any complaints about this process that is happening? Okay, if there is any measurable problem that you can actually test against standards. So there are so many questions that you can ask yourself and come up with a topic, okay? More questions. I basically tried to add a lot of brainstorming questions so you can feel like you can actually do an audit tomorrow. So is the topic of key professional or clinical interest? Are reliable sources of data readily available for data collection purposes? And this is very important. When you try to do an audit, you have to make sure that the idea is valid, it's interesting, it will grasp attention, and also the data is available. Because if there is no data, or if it's hard to collect the data, you will suffer, and the audit will take a long time, and it will just drag on and on and on, and everybody will lose interest, and the first one who will lose interest is you. So just make sure that the data is there, it's easily collected, and you can collect it, and it's measurable as well. Okay, and also the other question that is very important, I think this very last question, is the problem concerned amendable to change? Will you be able to change practice when you actually audit this problem and test it against set standards? Because this is the one question that will matter in interviews and will matter in your application forms and in your portfolio. Have you changed the practice with this audit? And if the answer is yes, then this is a good audit. And you don't have to change a major thing. It could be something very simple, very small, like adding a performer to a procedure that did not have a performer, for example. But then you change the practice after doing an audit that said, because there is no performer, the documentation of this procedure is very haphazard, and then you organize the documentation by adding a performer. That's just a very quick example, okay? Okay, so now you've done all this brainstorming, you've thought about the topic, you asked yourself all of these questions, and you decided with your clinical supervisor that this is a good audit and you want to do this audit, okay? Now you put a topic and then you decide on your aims and objectives. And it has to be very specific aims and very specific objectives, because if you ask yourself a very vague questions, or if you put a very vague aims, it's going to be very hard to measure it, and it's going to be very hard to present it as a reliable data and as a data that will be amendable to change, or a problem that can be changed afterwards. And then you've put the aim. For example, I want to do an audit on cannulation in A&E. Do they put the date on the sticker, for example? Okay, so that is my aim. Okay, now I have to design the audit structure. And designing the audit structure means I have to put my standards on, I have to design my data collection sheet, and then I have to put a time frame. So for example, I am going to audit the cannulation of the pediatric department in this and this hospital for this month. Okay, so it has to be very specific. All right. Okay. We selected the topic, we've put the aims and objectives, and they're very specific. Now we have to put the standards, okay? Now, we speak a lot about standards and guidelines, okay? And some people do not know the difference, and they are just interchangeable words, and they do not know that they are different when we are talking audits. So in the language of audits, when you say standard, it has to be measurable, okay? It has to be numbered. For example, the guidance say, all patients who have a cannula have to have dates on the cannula for when it was inserted. That is the guidance, okay? Now, what is the standard out of this guidance? The standard is 100% of patients with cannulas have to have the date of the cannulas inserted on their sticker or on their tegaderm, okay? So that's the difference between a guidance and a standard. The guidance is just saying all or most or whatever, and the standard is measuring it in number, okay? So how do we know that the standard is a standard? It has to be specific, it has to be measurable, and it has to be achievable, and also relevant to the clinical practice, theoretically sound and timely as in like you can actually limit it with a certain time. Okay, so now let me set another example. Now you are going to go back to your hospitals tomorrow and think of doing an audit, okay, in your placement. So you have a guidance in pediatrics of all children under the age of 12 have to receive, let's say, coamoxiclav if they have fever and this and this and this, okay? That's the guidance from NICE or whatever. Now you want to convert it to standards, then you have to say 100% of children under the age of 12 have to receive this antibiotic and the rest of the standards. And then upon the standard, you can actually design your data collection sheet. What are you going to look at? Cardixes, okay? What are you going to look at? Age, gender of the patient, okay? Documentation of allergies, for example. All of the things around what you need to collect can be put into the data collection sheet, okay? So now we've decided on the topic, we've put the aims and objectives, we've decided on the guidance that we want to audit, and we extracted our standards from it. And that's why I've put it in like 2 steps. We have the guidance, we extracted the standards out of this guidance that we are actually following. And now we have a new word here, is called target. Now there is a lot of people or a lot of requests that do not really specify the target. And this could be because they do not want anything less than 100% achievement of the actual standards. But in certain procedures or in certain areas, 100% is hard to achieve. So you have to have a target where the practice is acceptable for you. So let's say if 80% of the standards is achieved, okay, then that is an acceptable practice for you, but you are going to work harder on achieving the extra 20%, okay? And as I mentioned, the target is a term used to actually define the acceptable level of clinical practice that you want to achieve from this procedure or from whatever it is that you're auditing, okay? Now you actually now on the stage of sampling, okay? Now you know your guidance, you know your standards, you know the target that you want to achieve. Now, who are you going to audit and how are you going to audit this? Now there's so many ways, okay? For a very simple audit, because you know our placements as junior doctors are either 4 months or 6 months at most, and then we move to another hospital. So you can start an audit by the time you actually have a rapport with your clinical supervisor, brainstorm your topic, and actually discuss it with your clinical supervisor. And after the approval of the clinical supervisor, 2 months could be gone, okay? And now you have only 2 months before you go to your next job, okay? So the easiest way I find it is to actually have it a time-bound sampling. So for example, I want to audit, okay, all chest x-rays taken within the next month, okay? And what do I want to audit in chest x-rays? I want to audit the field of view. Is it a sufficient field of view? Are they compliant with the Royal College of Radiologists standard for field of view? I'm sorry, I'm again using something from my field, but then you can always apply it to pediatrics. So then if I actually specify it with a time, it could be a month, it could be 2 weeks, it could be 1 week, it could even be as short as 3 days. I remember when I was applying for my radiology interviews, I wanted to have at least one complete cycle of an audit, because all of the other projects that I had published were review of practice, and that's why they had an importance to be published in journals and in conferences. So I wanted a completed cycle because then it's 2 marks in the interview. So I audited a very simple thing, which is wearing the dosimetry in the department, because in radiology, you have to wear this dosimetry. Probably you know about it if you are doing any procedures in IR. Okay, so I've just basically designed a very basic performer on paper. Are you wearing your dosimetry? Yes or no? If no, why? Okay, and then do you know the importance of wearing a dosimetry? Yes or no? Okay, and then I basically went around the department for 1 day. I gave the performer for everybody. Everybody said yes or no, blah, 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 blah. I collected about 30 performance. I went home, put it in an Excel sheet, and I analyzed the data. And after that, I've put a poster. It's not a real poster, it's like an A4 paper, but then I designed it as a poster. And it says, don't forget your dosimetry for your health or something like that. I just don't remember. And then I've pinned that poster in everywhere in the department, in the board, in the corridor, in the registrar's office, and also in the X-ray inside. And after a week, I re-audited if they are actually wearing their dosimetry, and there was a very slight improvement change. So I said, I actually changed the practice. So an audit doesn't have to be something big, something great, something that is almost like a research. It could be a very, very simple thing, but then you should be able to measure it and you should be able to complete a cycle within a short span of time. Okay. And also thinking about, this is an example, but thinking about sampling, you can audit, let's say, a ward. Okay. You can audit patients coming to A&E within a week. So I think I talked a lot about this, so I'll just go to the next slide. Okay, we're still in the structure. So now you have basically selected your sample. So let's say I am going to audit the use of a certain antibiotic, let's say comoxiclav again, in children under the age of 12 who are admitted to the hospital, to, for example, St. Thomas Hospital, from the period of the 1st of March to the 1st of April, let's say. And in that case, my data is going to be prospective. You can always audit retrospective as well. So what are the advantages and disadvantages? So if you audit retrospective data, the advantage is the data is there. So you don't have to really wait for the data to happen or wait for things to happen. It's already there. You just go back and just collect it. But then the disadvantage is sometimes there are missing information that you want in your audit, in your data collection sheet that is missing from the actual retrospective data. And this could create some problems when you analyze your data. Now, this is retrospective. Now, prospective data is also good, okay? And the advantage is you actually have all of the information that you want from the for the audit that you're doing. But then the disadvantage is that you just have to wait till you know your period is over, or the sample, let's say your target is not target. So the target sample is 100 patients. So you have to wait until the 100 patients are finished. Now, inclusion and exclusion criteria. So after you've actually decided this is my population, okay, I am going to audit 100 patients, let's say, okay, or I am going to audit over this period of time. Now, because I specified, I said children under 12 years old and using comoxiclav. So this is my inclusion criteria. So children under 12 years old and using comoxiclav. So I'm not going to look at any other antibiotics. I'm just looking at comoxiclav, all right? And then exclusion criteria, I'm going to exclude all children above the age of 12, okay? Then now I have my sample, okay? And I need now to actually measure the performance. So how can I measure the performance? I need to first collect the data, okay? And then after I collect the data, I will of course analyze the data. And from the analysis of the data, I will draw conclusions and I will have recommendations. And then I will have my results ready for presentation. And this is in summary how you measure the performance, okay? Now, questions for data collection. Basically, what questions do you need to ask yourself before collecting the data? You first have to ask yourself, what type of data do I need to collect? Is it quantitative or qualitative, okay? And if it's qualitative, what questions? Is it yes or no, for example, in my data collection sheet? So let's say I'm creating an Excel sheet. And in this Excel sheet, I just have to have columns for every criterion or every standard. Criterion is better than standard because standard is the main thing that I'm auditing, but criterion is the contributing factors to that standard. So for example, if I am auditing the same example that I've done, which is the antibiotics in 12 years old, okay, I have to have the age, I have to have the gender, I have to have the administration of the antibiotics, okay, I have to have the date when they came into the hospital, for example, and the date when they received the antibiotics. I have to have some column for anything to add, or let's say additions or any comments, because some patients would have some let's say allergic to comoxiclav, and that's why they did not have comoxiclav, you know. So every criterion has to be measurable, and I have to know whether it's quantitative or qualitative, because if it's qualitative, I have to know what answer is the question. Is it yes or no? Is it true or false? So you have to ask yourself these questions. What data item will need to be used? Okay, like I just mentioned. What data sources will be used to find the data? Is it the electronic records? Is it the notes of the patients? Okay, is it the cardexes? Will a data collection tool need to be designed? I personally design data collection tools all the time because it just organizes my work. I hate paper performance, but in very, very specific audits, it's sometimes easier to do paper performance and then put it in Excel sheet. But I usually design Excel sheets for audits because Most of audits now are collected electronically, and most of hospitals now have electronic records for everybody. Will I need to collect data prospectively or retrospectively? Like I mentioned, what size is the target per population, and how long will the data be collected? Please don't choose audits that will drag on and on for months. You will not finish it, and you will lose interest, and everybody else will lose interest, and you will work on it for a while, and then that work will be lost because it's basically taking a long time. And how long would it take? Who will be collecting the data, and how will I ensure the data quality? Okay, so now we are in the stage where we've collected the data, okay? And we've put it in our nice Excel sheet, all right? And we analyze this data, and we have conclusions now. And we discovered that there is a serious concern because the clinical practice is not up to standard. My standard was 100% of these children have to receive coamoxiclav, but then I only received the result of 75%. So I have 25% shortage. So why is that? Then I have to discuss why did this happen. Is it because people are allergic, for example, to coamoxiclav? Is it because there is doctors who are not compliant with this prescribing guidelines? Are they prescribing something else? Okay. Are they using a different guidance that I didn't know? So you have to analyze and discuss why are you having this shortage in clinical practice, okay? And once you have a serious concern, like a very serious concern, you have to urgently report it to your clinical supervisor and to the personnel who are concerned with this problem. And then you have to take immediate action, which is presenting this audit as soon as possible in your department and basically giving a plan of action on how to fix this problem, okay? To implement change. Some of you will ask me, how am I going to implement change? Okay, you presented the audit and then you said, well, we have this problem, we have this concern, the clinical practice is not up to standard in this certain area. Now, we need something to be done to raise awareness of doctors, to raise awareness of, let's say, nurses on this problem, and we want them to comply with this guidance. So what I am going to do, I am going to design some posters like I did in the dosimetry audit and put it in the department. I am going to present this audit in regional, national, and international meetings to actually raise the awareness. I can send an email to all of the staff of the hospital about this concern and that there is a guidance on this concern or this shortage of practice or this clinical practice that is not up to standard. And I can actually tell them what we can do about it on that email. I can also publish it on the hospital intranet. And for that to happen, the audit department will heavily get involved because they are the ones who are concerned with publishing guidance, new guidances, or new announcements about clinical practice and clinical governance on the intranet of the hospitals. Okay, so this is how you implement change. And then you allow enough time for the change to happen. So for example, in the dosimetry, because it was simple, it was more than simple, it was the simplest thing that you can ever do. It was only that poster that tells you where the dosimetry, because we need to measure the radiation that goes into your body, okay, and that's all what it takes. And then I basically re-audited after a week. But then a week is enough for you to read that poster. There is no much to be done. But then in more complex problems and more complex clinical practice that has a problem, you sometimes need a longer time, let's say a month, 2 months, 6 months. But then you have to specify this in your first audit cycle or in your first audit to say, well, this is the change we're going to implement, okay? And this is the plan of action that we're going to do. And we'll wait for 4 months before we re-audit and see how are we doing in this problem. Are we actually doing better? Are we progressing in this problem? Or is it still the same, or is it getting worse, okay? And this is when you re-audit and close the loop. Now, my advice to you is always try to close the loop. And if you move to a different hospital, try to be in touch with the junior doctors in your previous hospital and try somehow to close the loops, because it always looks good in your CV, even if you're not the one who closed the loop of an audit that you initiated, or even if you are the one who closed the loop in an audit that you did not initiate, it's still considered as a completed cycle of an audit, okay? So, I've just added this definition for clarification. A completed audit cycle involves 2 data collections, at least. So if you say, I have a completed audit cycle, it has to have 2 data collections at least, and a comparison of one to the other, okay, following the implementation of change after the first data collection, as I just explained, in order to determine whether the desired improvement have been made, okay? Now, again, as I mentioned previously, an audit cycle can be completed more than once. You can audit again in 4 months' time, again in 6 months' time. And when you're happy that the standard is met, let's say you've done a cycle and then it's 100% now, okay, then you can actually prolong the re-audit period. You can say, I'm going to re-audit in a year, because obviously the clinical team seems to know what they're doing. So it's basically a waste of time to just keep on re-auditing every few months, because there's no concern. So you can just make sure that there is sustainable, good clinical practice by auditing in a wider or a longer period of time, okay? Now, this is basically an audit cycle, okay? You've finished all of this, okay? And if anybody is still awake and is still up to finishing the audit and submitting it to the audit department, it's time to write your report, all right? And when you write a report, it's actually the key step in doing an audit is to write the report, because this report will be needed to be submitted in the audit department. So the audit department will give you a form to register the audit, and then they will ask you, when are you going to finish the audit in the form? And then they are going to email you afterwards to ask you, have you finished the audit? And if you finish the audits, they give you another performa or another form to fill in the background of the audit, what standard have you used, and what were your aims and objectives, and how did you collect the data, what were your results, what was the discussion or recommendations, conclusion, and the plan of action, and the time of the re-audit. This is how detailed that form is. So if you write an audit report in that form or in that structure, then your life will be easy. You will just basically copy and paste into that form, and you will copy and paste in any abstract submission or in any conference presentation. So it will just make your life easy. So how can we write the report of the audit? You first have to write the title, okay? And the audit report should be very, very simple and clear. Don't try to use very fancy data analysis, because then it just confuses whoever sees it. I just feel like the nicest audits presentations that I've attended had very, very simple way of presenting the data in pie charts or bar charts. And even I, who doesn't understand anything about pediatrics, can still understand the results, because it's very nicely and neatly presented, okay? Try not to use a very hard English words, just plain English, very simple, because it's just nicer to hear simple language. Okay, there is a structure that I always use, and I think is very useful. If you use a structured or systemic approach for MRAD, which is introduction or background, and then the method you used. So, for example, you could say this is a retrospective study of the usage of comoxiclav in children under the age of 12 in St. Thomas Hospital in the period of this month to this month, okay? So that is your method. And then you can say inclusion criteria, all children under the age of 12, blah, blah, blah. Exclusion criteria, all children above the age of 12. This is the methodology, okay? And then you write your results. Okay, and writing the results is probably the most tricky part of doing an audit. And that's why I love to use Excel, because I can just use simple tables of the results that I came up with and simple bar and pie charts. And then you can basically do a discussion. And in this discussion, you can actually discuss where did the clinical practice come short? Why did it come short? What can be changed, okay? And what are the national and international consensus of the same problem? So you have to do a little bit of research online and a literature review, and this always makes your audit look really good, okay? Which would include recommendations and agreed quality improvement plan, okay? Then you would write conclusion and action plan. So conclusion, this is what I found in my audit, and then action plan, okay? And then the time of a re-audit, all right? I also added present descriptive statistics graphically where possible. Obviously, visual data is always better than written data. So if you tell me, for example, 53 patients out of 196 patients have achieved this or this you know, it's just harder to comprehend when you are seeing a presentation with words than graphics. So graphics are always good. So try to also make sense of what you're saying and try to be logical in the progression of your presentation, because this also captures the interest of the clinical team and whoever personnel is involved with the audit that you're doing and can help implement the change or help give the funding or anything from what you want to achieve, okay? And also be easy to understand. The report should be written in such a way that it could be understood by any colleague from a different discipline. A good report will make even a complex issue understandable to all, okay? So always remember this when you are writing an audit report. Okay, now we will have a poll, and the last poll of the day. If you're still awake, please do participate. It makes me feel better that you did not sleep halfway. Can we have the poll, please? Yeah. So have you published any audits in a journal or in a meeting before? And I also want to know, how do you view submitting an abstract? Do you think it's a hard work? Do you think it's easily done? Do you think it cannot be done for small projects? I have 23 out of 43 participating. So there is around 20 people hibernating. Come on, people, wake up. Okay, that should do. So the majority said that they haven't published anything before. Well, the good news is you can publish any audit you do, okay? And submitting an abstract is hard work, but possible for every audit. Yes, I'm glad that everybody thinks this, or not everybody, well, the majority thinks this. And it's easily done once the report is ready. That's also very, very true. That's why it's very important to write the report once in a very good way and just leave it as a backbone for everything else that you need to submit out of it, okay? Cannot be done for small projects. That's not true. There is always a journal for every project. There is always a conference for every project. I remember I submitted a very simple audit about cannulas to a junior doctor's journal, and they actually accepted it because it's a junior doctor's journal. So this is the type of audits that junior doctors do. Okay, so do not give up on any project that you do. All right. Okay, so I encourage everybody who does an audit, because audits are hard work, okay? It's time consuming, and it is something that can look really good if you actually submit it for publications. And it's very simple. You just have to know what meetings are upcoming, okay? Go into the meetings website, submit an abstract, just see what structure are they following, because every meeting or every conference has a certain structure for abstracts, and try to copy and paste from your report. And if there is any word limitations, for example, just try to fix accordingly. That's as simple as it is, okay? And the worst thing that they can tell you is, no, we don't like your audit. We're not going to allow you to present it as a poster, for example. So there is no harm on trying every single project that you do, every single audit that you do, try to submit it. Do not think that your work is small enough not to be submitted, okay? So this is the point I wanted to make. Almost all audits are publishable, okay? And you just need to find the right meeting that is actually interested in your audit and be proactive. Go and find these conferences, go and find these meetings. Don't wait for your clinical supervisor to tell you. Don't wait for the consultants to tell you. Just go and try to find out yourself, okay? Now, I don't know if everyone is in pediatrics, and I gathered some of you are actually practicing in the UK and some are outside the UK but willing to come to the UK, or newcomers. So I went into the Royal College of Pediatrics and Child Health and actually extracted this domain from the curriculum about quality improvement projects. And when you join a training program, of course, you know, if you are in a training program already, you would know, you would be asked to fulfill certain levels of things. So the 3 levels of quality improvement projects or audits are these 3 levels. So if you are in the very beginning of your training, you will be asked to actually achieve level 1, which is applies quality improvement methods, example, audits and QIP projects under guidance. So someone has to guide you, a senior colleague or the supervisor, and then you can actually do an audit. But then level 2, you can independently apply your knowledge of quality improvement projects to undertake projects and audits to improve clinical effectiveness and patient safety, blah, blah, blah. Now, level 3 is a bit advanced. So level 1, you have to participate. You could be just the data collector, for example, or you just have to have guidance in each and every step. Level 2, you have to have leadership to do it all on your own, okay? And then level 3 identifies quality improvement projects opportunities. So you have to actually find the problem yourself. No one will come and ask you to do an audit about this topic, for example, or this problem. Now you are a senior trainee, you are almost becoming a consultant in a few years. So you have to have that initiative and that proactiveness to actually find out where is the clinical practice going wrong and where is the patient's care compromised, and to fix it, okay? So you have to surprise, actually, I've just copied and pasted, this is not my own words, surprises healthcare professionals in relation to improvement, okay, or improvement projects, leads and facilitates. So you can actually lead the project and also delegate. So for example, you can have an audit about 300 patients, but 300 is a large number. You don't have to do it yourself. You can facilitate junior colleagues to actually collect the data for you and analyze it, and then you can draw conclusions out of it and write a very interesting discussion about it, okay? So leads and facilitates reflective evaluation in relation to quality improvement interventions. So these are the 3 levels of the Royal College, just in case you're wondering, what do you need to achieve in terms of audits while you are in training? And this also applies to you if you are in a trust grade jobs, because if you don't have ARCP as a doctor, you will have appraisal in the end of the year for revalidation. So still the same principles apply. So you still have to get involved in audits and to do and lead audits. Okay, I hope the 20 people who were awake 2 minutes ago are still awake. And I know I talked a lot about lots of things, but I will try to summarize and try to simplify the whole process. So there are a few things that I want you to remember from this presentation. One of them is it's very simple to do an audit. You just have to choose a very simple topic, and you have to choose a topic that does not take a long time to audit, and also something that is specific and measurable and can be re-audited in a very short period of time so you can complete the cycle, okay? And remember to keep the audit simple and always have a plan and a structure. Get everyone involved. So get your clinical supervisor involved. If it's something that has to do with nurses, get the nurses involved. Get your junior colleagues involved, your senior colleagues involved. It's always good to have a team. And do not collect needless data. So do not waste your time on collecting something that is not going to add to the discussion of the audit. And also, close all clinical audit loops. As I mentioned, it's always good and it looks very good in your CV, okay? Keep the data only for as long as it is needed. Don't try to drag on data collection. Try to put a time limit to that, okay? Also, pay attention to statistics and graphics, not graphics, the graphs that you put, because it basically tells you a lot about the person who's analyzing the data if you have good graphs and informative, accurate graphs. Of course, if the audit is something that is concerned with funding or a major concern in clinical practice, tell the organization about your audit and share your learning. Tell everyone about your audit, tell everyone about your results, and also make sure you sustain the cycles of an audit, especially if it's about a topic that you have a special interest in throughout your career, okay? And that's it. I'm done. I talked a lot and I'm ready for questions if you have any.
Thank you very much, Dr. This very valuable topic today. So I think there is a question from Mohammed Osman. He popped it in the chat. He asking that he did an audit, but the guidelines have been changed. So if the re-auditing could be considered a completion of a cycle.
I don't think so, because then you will have a different standard from the new guidance. So you can just start a new cycle again. So you can start a new cycle and link it to your old audit in the discussion. So you can audit the new guidance and how is the practice up to standard. And then when you come to the discussion bit, you can mention your previous audit on the previous guidance and that this guidance has been changed and now the practice is this on the new guidance. But then I don't think technically it's a complete cycle because it's a new guidance.
All right. I don't see any question in the chat. Guys, do you have any question? No more questions. So thank you very much, Dr. Reem, for this valuable talk. We hope we could have some in the near future. Sorry, guys, for this technical issue. You can find and record this session in the association website and the Facebook group. Thank you for your attendance. We appreciate really if you are filling the feedback form, and this will help us with upcoming future topics. The certificate will send in a few days after receiving the feedback. Thank you and have a nice day.
Thank you very much for listening.